I am about to show you why the 5 routine medical checkups your doctor casually orders every single year, the ones they smile and call just preventative, are actually triggering a catastrophic, irreversible biological demolition inside your body. If you are over 60, you need to hear every word I'm about to say. Because what is happening inside those sterile, fluorescent lit clinics is not medicine. It is a conveyor belt. It ends in one of two places: a pharmacy bag stuffed with chemical sledgehammers, or a surgical suite where someone with 15 free minutes is about to shove metal rebar into your most critical biological pipes. The modern medical establishment does not treat root causes. It does not look at the biomechanics of your skeleton, the fluid dynamics of your vascular system, or the electrochemical architecture of your cellular membranes. It sees a number on a printout and it reaches for the nearest prescription pad. And for people over 60, that reflex is not protecting you. It is actively destroying you. Today, I am going to expose exactly how each one of these 5 so-called preventative screenings works against your biology. And I am going to give you the physics-driven protocol to armor yourself so completely that you will never need to sit in one of those terrifying rooms again. Stay with me. For the next 15 minutes, we are going completely off the standard medical script. Your primary care physician is not going to explain the osmotic physics of what that colonoscopy prep is doing to your kidneys. Your cardiologist is not going to describe the turbulent shear stress a metal stent creates inside your arterial wall every single second it sits there. Your orthopedist is not going to tell you that the bone drug they just prescribed is quietly turning your femur into brittle, hypercalcified chalk. But I am. I have spent decades at the intersection of functional medicine, vascular physics, and cellular biomechanics. And what I am about to show you is the documented biological reality that the 15-minute standard of care is designed to keep completely hidden from you. Before I break down every one of these 5 dangerous procedures, I need something from you right now. Go to the comments and type the word SHIELD. That single word gets you my complete biological defense protocol, the exact framework I use to keep every patient in my clinic permanently off the procedural conveyor belt. And while you are down there, tell me which of these checkups your doctor has already been pressuring you to schedule. I read every single comment. I want to know exactly what they are pushing on you. Now, let me tell you about Margaret. Margaret was 68 years old and she was a biological powerhouse. She gardened every morning, swam 3 days a week, had 0 chest pain, 0 shortness of breath, and 0 neurological symptoms. She went in for a routine annual physical feeling completely fine. Her doctor found a mildly elevated cholesterol number. Not dangerous, not symptomatic, just a number, and immediately ordered a cardiac stress test. The test threw a shadow. The shadow triggered a catheterization. The catheterization found a small, completely stable, asymptomatic calcified plaque sitting in her left anterior descending artery, doing absolutely nothing for probably 15 years. A stable plaque is like dried concrete bonded permanently to the inside of a pipe. It is not going anywhere. But they did not leave it alone. They deployed a metal stent, rigid, jagged, foreign metal shoved into her smooth, living arterial wall, and put her on dual antiplatelet therapy. Within 4 months, Margaret could not garden. She bruised catastrophically from the slightest contact. She was dizzy, exhausted, and terrified. The woman who swam 3 days a week could no longer walk to her mailbox without stopping. She found my clinic as a last resort. When I looked at her full biological picture, her glycocalyx integrity, her mitochondrial output, her intracellular hydration, what I found was a woman whose entire vascular architecture had been systematically dismantled by an intervention she never needed. We rebuilt her from the ground up using the exact protocol I am going to give you today. Margaret is swimming again. That is what this masterclass is about. Here is what is actually happening inside your body during each one of these 5 procedures, explained with raw physics and cellular biomechanics that no doctor in a 15-minute appointment will ever take the time to give you. The first is the routine colonoscopy pushed aggressively on seniors past age 75. Before the procedure, they hand you a gallon of synthetic osmotic laxative and tell you to drink all of it. What they do not explain is the hydrostatic catastrophe that liquid causes inside your vascular system. Your bloodstream is a pressurized hydraulic circuit held in balance by a precise osmotic gradient, the difference in mineral concentration between the inside of your vessels and the outside. That osmotic prep acts like a biological shop vac. It violently pulls water and critical electrolytes, potassium, magnesium, sodium, straight out of your bloodstream and dumps them into your colon. Blood volume drops, hydrostatic pressure collapses. Your heart is suddenly pumping thick, dehydrated sludge through your entire circulatory system. Your kidney tubules, the microscopic filtration pipes that clean your blood, get starved of oxygen and begin to die. Your cardiac electrical system, which depends entirely on potassium to fire its pacing signals, starts misfiring dangerously. You are risking acute kidney injury and catastrophic arrhythmia to screen for a cancer that poses statistically near zero mortality risk to you at this stage of life. The second is the asymptomatic cardiac stress test. They put you on a treadmill or inject a chemical vasodilator to artificially force your heart into a simulated exercise state. Here is what they are ignoring. Your blood vessels are lined with an extraordinarily delicate microscopic coating called the endothelial glycocalyx. Think of it as a biological Teflon layer, a gel-like electrically charged mesh that keeps your blood moving in perfect laminar flow, smooth, forward-moving, frictionless. When the stress test throws a shadow, and in asymptomatic seniors, false positives occur at a staggering rate, they take you to catheterization. That catheter physically shreds the glycocalyx off the arterial wall, like sandpaper dragged across velvet. Then they deploy the stent. Imagine forcing rigid chain-link fence into a smooth rubber hose. The blood can no longer flow in clean laminar streams. It churns in microscopic turbulent eddies that create shear stress against the raw arterial wall, triggering inflammation and platelet aggregation, paradoxically causing more clot formation. They are creating the exact biological disaster they claimed they were preventing. The third is the DEXA scan and the bisphosphonate prescription that almost automatically follows it. The machine says you have osteopenia, a diagnostic category invented almost entirely by pharmaceutical marketing. And the doctor hands you a prescription without one word about what that drug does at the cellular level. Your bones are not chalk sticks. They are dynamic, living tissue maintained by two opposing cell populations. Osteoclasts dissolve old bone matrix. Osteoblasts lay down fresh, flexible collagen. This constant cycle of demolition and reconstruction gives bone its tensile strength and its ability to absorb impact without fracturing. Bisphosphonates poison and kill the osteoclasts entirely. Bone turnover stops. The bone looks denser on a scan because dead, hyper-mineralized tissue appears dense on imaging, but what you actually have is a skeleton turned into brittle concrete. When you trip, it does not flex, it shatters. The drug prescribed to prevent fractures causes catastrophic, atypical femur fractures, complete transverse breaks through the midshaft that sometimes occur simply from standing. The fourth is the asymptomatic carotid artery ultrasound leading to surgical endarterectomy. They scan your neck, find calcified plaque that has been silently present for 2 decades, and decide to scrape it out surgically. The biomechanical reality they refuse to acknowledge is this: calcified plaque in a senior is biologically inert, hardened, encapsulated, and fused to the arterial wall. It poses no acute embolic threat. But the moment a surgical instrument goes in and scrapes, it shatters that stable mass into thousands of microscopic debris particles that travel directly upstream into the microcapillaries of your brain. You are inducing intentional, physician-caused microscopic strokes, trading a silent, stable, harmless anatomical adaptation for measurable cerebral damage and the slow suffocation of your cerebral mitochondria. The fifth is aggressive low-risk cancer screening. PSA tests, low-dose CT lung scans, thyroid ultrasounds, Technology now so extraordinarily sensitive, it finds microscopic cellular anomalies that will never harm you in your natural lifetime. I call these biological barnacles. Indolent, slow-dividing clusters that grow at a pace so glacial they will never reach clinical significance. But once the machine labels them, it treats them. And treatment means chemical napalm and targeted radiation that cannot distinguish your barnacle from your thriving mitochondria. Your cells run on ATP, adenosine triphosphate, fuel manufactured inside your mitochondria. Chemotherapy and radiation shatter the mitochondrial membrane and collapse ATP synthesis, starving your healthy tissue of the energy it needs to survive. They are burning the entire house down to kill one termite. Now here is my exact master protocol to reinforce your biology so completely that none of these procedures will ever find a foothold. Step 1 is rebuilding your endothelial glycocalyx, the Teflon armor lining every blood vessel in your body. You need 2 simultaneous inputs. Mechanically, 30 minutes of continuous brisk walking every single day. This specific pattern of rhythmic blood flow creates a shear stress signal that commands your endothelial cells to produce glycocalyx repair proteins. Biochemically, standardized beetroot extract paired with high-dose vitamin C. Beetroot delivers dietary nitrates your body converts into nitric oxide, the molecule that mechanically dilates your vascular pipes and drops arterial wall pressure. The vitamin C acts as a chemical bodyguard, protecting that fragile nitric oxide molecule from free radical destruction before it reaches the target. Do not use cheap L-arginine. Your aging liver oxidizes it before it ever arrives. Step 2 is dynamic bone matrix reconstruction. Stop taking isolated calcium supplements immediately. Without the proper biological routing proteins, that calcium deposits directly into your arterial walls as vascular calcification, hardening your pipes from the inside out. You must take vitamin K2 in the MK7 form alongside vitamin D3. K2 activates a protein called osteocalcin that physically pulls calcium out of soft tissue and drives it into the collagen matrix of bone where it belongs. To build that matrix, you need eccentric resistance loading. Lift a moderate weight and lower it on a deliberate 5-second count. That slow eccentric tension generates a piezoelectric electrical charge in the bone that directly stimulates your osteoblasts to lay down fresh, flexible collagen, making bone springy and fracture-resistant instead of brittle and catastrophic. Step 3 is achieving true intracellular hydration. Drinking plain water when you are over 60 does almost nothing because your aging cellular membranes have lost the osmotic gradient that pulls water inside the cell. Every morning, the moment you wake up, mix a 1/4 teaspoon of raw, unrefined Celtic sea salt into 16 ounces of filtered water with a full squeeze of fresh lemon. The over 80 trace electrolytes in Celtic sea salt act as chemical vice grips, binding to water molecules and driving them through your cellular membrane via osmotic gradient. Your mitochondria expand, your blood viscosity drops, and your kidneys, heart, and brain receive the fluid pressure they need to operate at full biological capacity. This channel is the only place on the internet where you are going to get the unfiltered biomechanical truth the medical establishment has decided you are not allowed to have. Subscribe right now. Hit that button. Turn on the notification bell. Do not miss a single masterclass, because every video I publish is a direct weapon against the system that is trying to put you on that conveyor belt. You are not a broken machine. You are not a checklist of declining numbers waiting for a pharmaceutical fix. You are a magnificently complex biological system built for decades more of power, clarity, and complete physical freedom, if you give it the right inputs. Stop letting them treat you like a problem to be managed. I'm Dr. Claire Vega. I'll see you in the next video.